This is Average Joe PT, where we're here to reduce pain, reduce anxiety through education, and improve function with techniques that you can do in your own home. Now today we're going to talk about scoliosis and what you can do to help reduce your symptoms due to scoliosis. Stay tuned. Let's start out with what is scoliosis. Scoliosis is a curvature of the spine. Now, if we look at a normal spine is going to look something like this, where if you look at it, it's got a nice curve for the neck, nice hump for the mid back, and a nice curve for the lower back. So you can see you got the three curves in your spine. Now, if you don't have the three curves in your spine, a lot of times what you will have is a C, or in this case, you're going to have an S curve. Now an S curve looks something like, literally, you can have an S. And depending on which way it's going, as you can see, this side is a convex, and this side is a concave. So depending on the actual curve of the spine will depend on what they name it. Now the big thing is to take away is when you age, let's get through that growth spurt, when you're all done with growing and if they haven't detected that scoliosis, all we can really do is help stretch and strengthen. But if they catch it before you're fully grown, sometimes they can put you in different types of shells, basically braces, that kind of get your spine straight again and take some of the curves out, and then hopefully as you grow the rest of the way, your spine will straighten out. Now if you want to leave some comments down below, and just if you want me to discuss different types of curves and what they can do with your age, go ahead and leave those comments and we'll talk about that. I'm going to leave a little post up here. It talks about some back symptoms, a little clip card. But now let's just say that you're fully grown and you're in your 30s, 40s, 50s or whatever, or even beyond, and they say, hey, look, we've noticed that you have a scoliosis. And most of the time people are coming to physical therapists because they're having back pain, not because they're having the scoliosis. And so essentially what we're looking for is, can we reduce your pain, reduce that stress? And so if we look at the spine, we look on the back side, this being the side, this being the front, and we look at the back. Now if you have a scoliosis, you're going to have a turn one way, as well as you might have some rotational movements that are going. So you're going to have a curve. If you look at a simple little tubing here, now you might have that nice little curve, all right, but you're also going to have some rotational movement too with it. So it's not going to just be a tilt or a rotation or a curve to one side. You're also going to have a rotational component too. So when you look online and they show you these different types of techniques to kind of correct your scoliosis, they're not completely correcting your scoliosis. I hate to break it to you, but once you get past that growth spurt, you're not going to correct that scoliosis unless you're going to have surgery. And only time an orthopedic surgeon will actually deal with that type of problem is if you have a significant curve where it's affecting your ribs and how your ribs open and close. If you're having some sort of respiratory issue going on, then they'll probably go ahead and correct your curve enough so that they at least limit any type of respiratory issues. But they're not going to do surgery just because you're having some back pain. They're going to send you probably to either physical therapy, they might send you to a chiropractor, they might send you to an acupuncturist, or they might just send you to a pain management clinic. But that all being aside, what you can do at home to help at least mitigate some of the pain is what we're going to go over today. So go ahead and stay tuned. Now the big focus of here is essentially trying to reduce the tight side and strengthen the elongated side. That's the main focus of physical therapy and scoliosis. Now you can add some core stability exercises in there with you, and we can talk about that if you'd like to next time. All right, but this is the big thing. Get yourself a little physio ball like I showed in some of the other episodes. Now you can get this at probably Amazon or Walmart for probably $10, $15 at the most. A lot of exercises that we'll do in the future as well as today will incorporate the ball. And there's also some rubber band stuff that you can do that I'll show you today that you can easily do the same thing. You can get a whole roll. Now you can get tubing or TheraBand. It's really up to you. So let's just say the scoliosis is the S curve, and that we have some tightness on this side, so I'm kind of tilted like that. All right, so what we're going to do with the ball anyways is we're going to try and elongate this left side. So all you're going to do is just gently come over on the ball and just come over the side. And you're going to hold that for a good 15 to 30 seconds. You should just feel pull. You shouldn't have any pain. And the more you go, the more pull you'll feel, and then come back, roll back, and relax. And you're going to repeat that 3 or 4 times. So 30 seconds to a minute is kind of like the gold standard of a stretch, and then come back and relax. That's a nice little stretch to do just for your trunk. Now it shouldn't be painful. And then, since this is the short side, and that's what we want to do. We want to stretch that out. Next exercise you're simply going to do with the ball is bring it right down here on your back, ball right over the top, and all we're going to do is just roll the ball in. Roll the ball in and out. Do that nice 30 times. This is a nice stretch for the lower back. Takes all the pressure off of the lower back completely, and then you can come back and relax and roll over the ball so that your legs are kind of in a nice rested position. And this next one you can easily do is just kind of rock back and forth, kind of stretching out that over tight side, and then come back and relax. You only go to the point where you feel a pull. Don't go to the point where you're having any pain, and then come back and relax. Basically 15 to 30 seconds up to a minute if you're on the stretch. And you can get it from both sides. Nice little rotational movement. Now, some of those rubber band exercises we want to work on. Pretty simple. Now, each band can come with different color, different resistance, but we're going to start out with the basic one called the clamshell. All I want you to just take the band and tie it around your leg. Just like that. Nice simple little nut. Feet together. Open and close. Pause and then relax and close. Pause, relax, and close. Pause, relax, and close. That's going to work your hips a little bit. It's going to work your rotator muscles. You might even want to pull your belly to your spine and then open and close. Nice little combination move. Do about 30 of those. Next one to do, come on your side. Come up on your elbow a little bit. And just lift and close. As you can see, I can tuck my hips in. Bring my hand over so I'm not rotating down, keeping my hip and core engaged. Up and close. Up and close. Up and close. So that's an easy one to do. Do both sides. And that's, you're going to feel it right in the hips there. That's a nice core strengthening exercise to do. I'm going to time myself here for a second. Now you could do that clamshell on your side if you want to, instead of doing it on your back. Open and close. That's an easy one to do. Pause and then relax. So that's some basic resistance exercises. Now if you want to do more resistance-based exercises, and you want for me to give you a little bit more exercises with regards to the rubber band in scoliosis, just leave a comment down below and I will. Now we're going to go ahead and finish up with some of the ball exercises, and then we'll go from there. Stay tuned. To the pelvic tilt where you flatten your back down under the bed. Real simple, holding for about 5 seconds. And then come back and relax. So you can see my low back kind of arching here a little bit. And then come back down, pull the belly button towards the spine, as they also call it, or flattening your back, and then back and relax. Another nice one. Now after that, 15, 20 times. Next what you can do is just come up, lift, nice little bridge. Woo! You can work hard if you want to, or you can just kind of hold it straight. Extend your arms out if you want to, so that way you're not cheating and pushing down, and then come back and relax. The further you bring the ball away from your body, the more struggle or harder it will be. So you can play with that. The ball either closer to your trunk or further away. You can make it even harder yet, and you can come up even higher and hold that. Alright, I'm kind of showing off a little bit, but there's a nice progression just to that one movement. One movement is like this, nice and easy, and then work your way out, nice and easy, and then working your way like this, nice and easy. And if you're really strong, you can extend one leg out, switch, and do the other leg, and then come down and relax. That's a nice progression. Now you would do that over probably anywhere between 3 and 4 week period. You do probably 6 to 8, maybe up to 10 reps, and do a couple sets of that, and then repeat that. Excuse me. That's a simple bridge progression that you can do, as well as a progression for core stability exercises, and just some basic stretching that you can do at home for scoliosis. Now, if you have any more questions, leave the comments down below. If you want me to show you a little bit more exercises in regards to scoliosis, we can. That's easy to do. But until next time, I want you to look up and keep smiling.